Is This Normal, Doc? A podcast sponsored by Tanner Clinic. Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal health care provider.
Welcome back to another episode of Is This Normal, Doc? Once again, I am your host. My name is Hope, and Victoria will be my co-host today.
Hi, I work with Hope on our marketing team, and I'm excited to be here.
Today, we are going to be talking to Dr. Matthew Naegle. He's one of our newest providers at Tanner Clinic, and we're just so excited to be able to ask him questions and get his input on those. I just want to give him the opportunity to tell us a little bit about himself, how he got into pediatrics, and how he got to be working with new parents and his passion for that.
Hi. Yeah, thanks for having me on today. I am excited to be here.
We love that. We love that you're excited.
I'm excited to explain, a little bit about my passion for pediatrics, but I'm from Bountiful, Utah, born and raised there. Once I got into, medical school and started down that path, I started to, do all of my rotations. And when I was around kids, it just was so much fun. Mm-hmm. People are nice and bright, and the kids are awesome. They're super fun to be around. But I would say the thing that really solidified my decision to go into pediatrics was my desire to learn about development. Human development is so interesting to me. It's miraculous. So many things are pre-programmed and just happen and work out, from the prenatal period to birth to, kids being toddlers, making it into elementary school years, all the way up to adolescence. There's so many things that happen and come together in such a coordinated and miraculous way. It's awesome. I love it. And I love my part as a pediatrician in helping to maximize that development. Yeah. So another thing that drew me to pediatrics was I'm also a parent. And I know how scary it can be to be a first-time parent. Yeah. When you go home from the hospital, it's no one's there to help us. What is this?
They just let us leave?
Is this legal? Yeah.
Who's letting me do that?
And then it's all of a sudden 2 a.m. and your baby's crying, and, you're both really just nervous and worried that you're doing something wrong. Yeah. And so I love being on the front lines to provide reassurance and to provide direction and you're doing great. Just keep it up. I love that. It's a lot of fun for me.
Yeah. So in today's episode, we're going to be diving into what happens when you bring your first baby home as a new parent, what's normal and what's not. So let's get started.
Yeah. So I guess we'll just start right from the beginning. What should parents expect when they're first coming home from the hospital, or when they're first at the hospital?
Yeah, this is a common question I get when I talk to parents before they deliver. It's what do we do to get ready for the hospital? What can I expect at the hospital? And most of the time, my answer is you don't have to do very much. Mm-hmm. So much of it is just taken care of for you, that you don't have to plan and schedule specific things to do in order to do it right. So there's not a lot to worry about. You'll be talking with your OB provider as a couple to know when to go to the hospital. Once you're at the hospital, you just need to show up. You don't really need to pack your bags and bring things. If you want to bring your toothbrush and your special blankie or something like that you feel comfortable sleeping with, great. Do that. But you don't need to pack specific things to go into the hospital. And then you just say hey, I'm in labor, and people will help you. It doesn't matter what door in the hospital you go in, people will help you go where you need to go. Once you're there, depending on the hospital that you're at, you will either deliver in one room, and then once you've delivered your baby, be taken to a postpartum room where you'll spend the rest of your time there. Other hospitals have you do it in the same room. You deliver and then you spend your postpartum time all in the same room. So those are some things that you can look forward to in the background, there's a lot of things happening to ensure that your baby is safe and that your baby is doing all of the normal right things, like the feeding, the wet diapers. We're measuring jaundice and a lot of things like that. But you don't need to like plan or prepare for any of those things.
Right. Are there things like certain vaccines they get right off the bat or other testing that they do that you as a new parent might be having some questions about?
Yeah, absolutely. So I would say the first thing, decisions that are made is, can baby go back to mom and do skin to skin, like right away? And there's a few questions that we ask ourselves as like specialists for babies to help us decide if that's safe or not. Number one is baby term? And we define that as, was the baby born at 37 weeks gestation or later? Does the baby have good muscle tone? Do they flex their arms and their hips normally?
Are they buff? That's what made me think. The baby's like flexing in the wow.
Babies surprisingly are pretty strong. They like that flexed position. So yeah, are they buff? And then the third one is baby crying and breathing normally? For obvious reasons. So if the answer is yes to all those questions, it's highly likely baby's going to be able to go to skin with mom. Next, we also talk about like newborn medications. Sometimes they're known as that, but what we're really talking about are interventions that we do right off the bat to really help reduce serious illness and disease in your baby. So first and foremost is vitamin K injection. So that usually happens in the leg, and that helps reduce serious brain bleeds in babies. Very, very important. The next one is an erythromycin ointment. It's an ointment that we put around the eyes, and it helps reduce or prevent blinding infections that sometimes are circulated in the population. You just never know when that specific infection is prevalent or not, and it's such a low risk intervention. It's just a really good idea to do. And the third one is the hepatitis B vaccine. The evidence is very strong to support that it's safe and effective. I highly recommend it. It's just totally prevents your baby's chances of developing chronic liver disease. It's safe and effective. Why not do it? So those are the things that are typically done in the hospital. Now, if your baby's born, maybe it has some respiratory problems early on, is born in the middle of the RSV season, we may also talk about getting your baby an RSV immunization in the first week of life.
Yeah.
So
I guess another question that a lot of first-time parents might have is, what kind of items should they purchase before baby is delivered that are essential for right when you get home from the hospital?
Yeah, that's a great question. So if your mom or your grandma or your aunts haven't already told you, you're going to want to have a car seat, right? That's going to be one of the first purchases you make. Car seats are going to need to be rear-facing. You can buy a convertible car seat that can go forward-facing and rear-facing. You'll just use it rear-facing for the first 2 years of life. And then as long as your baby is within the weight parameters set forth by the manufacturer, those are great options. So you're going to want a car seat. You're going to also want to have a place for your baby to sleep. So either a crib or a bassinet. We'll talk about that later, but you'll want to make sure that those fit certain criteria. You'll want to get some swaddles, obviously have some diapers ready. I like to get the onesies. They're little shirts that snap around the diaper, but also they're long sleeve and they cover the hands and the fingernails to prevent babies don't scratch themselves. Yeah, those tend to work really well as opposed to the little mittens that can fall off really easily. Yeah. I also like getting some form of nasal suctioning in preparation for any sort of respiratory illness that your baby could get. I like the brand Frida Baby, but anything like that is essential for when your baby is sick.
One of the biggest questions that we received from parents was, sleep is really hard with a newborn baby. So sleep schedules were something that parents were really concerned about, but also safe sleeping. SIDS is really scary, and a lot of parents want to know the best ways to prevent that. So what tips can you give for that?
So there's a lot there. I know when I was a new parent, it was a little bit of a shock for me, like the sleep schedule.
Yeah.
And the little amount of sleep that I got as a parent. But it did get better, and there are some strategies that do help. So I think it's important for parents to know that your baby will sleep for 18 to 21 hours a day. It's like a lot.
Like a koala.
It's so much.
She knows a lot of animal facts.
I'm sure there's more.
Or like a sloth or something.
Yes. And so it takes parents by surprise a little bit, but that's normal. And the other thing is that babies would need to wake up every 3 hours to feed. And so you as the parent will be waking up every 3 hours. So your sleep schedule changes drastically.
Yeah.
Lots of power naps.
Yes, lots of power naps throughout the day. And we'll talk about that, I think, coming up in a little bit, some ideas that I have to help the parents manage that. But when we're talking about sleep and infant sleep, what we're also talking about is SIDS and how to reduce the risk of that. And what that stands for is sudden infant death syndrome. And first we talk about making sure that the baby gets laid on their back to sleep and not on their stomach. That's changed off and on throughout the years, but the evidence is pretty strong recently that it's best when babies are laid on their back. That's how we can reduce that risk. Also, we want babies to be laid in their own sleeping space when they're sleeping, when everybody's sleeping. It's okay to bring baby in bed with you while you're awake and baby's sleeping. Mm-hmm. But as soon as you are tired and you are sleeping, baby needs to go to their own crib or bassinet. That's the safest place for them. Obviously, we want them to have, a mattress that is relatively firm with sheets that fit very tightly around the mattress. Mm-hmm. And we want to take out any extra blankets, pillows, teddy bears, any toys in there that could potentially cover the face.
Yeah.
So these are all things that can drastically reduce the risk of SIDS.
I have heard a lot of parents that have started incorporating that, into their baby's sleep. And a lot of the older generation is like, give them a blanket, give them a teddy bear. And they're like, well, this is what I heard. And so this is what I'm going to start incorporating with my baby. Like, they need to be sleeping. It's not going to be a big deal if they don't have a stuffed animal in there with them or whatever.
Early on. Yeah. Much later, when they're toddlers, they tend to appreciate those kind of toys a little bit more.
I don't know. I just look back at photos of like my brother and myself in the 90s, late 90s. And I'm like, whoa, that is maximalist stuffed animals.
We were stuffed animal generation. Well, all kids are.
Yeah. Kids love stuffies.
Oh, yeah. True. Oh, yeah. I still have stuff.
But I definitely see how, like, as a newborn baby and as an infant, it can.
But even like a blanket, you know.
But even as a blanket, I never thought that would be a risk.
Do you recommend those sleep sacks? I know a lot of parents use the sleep sacks instead of like a blanket or something like that.
So babies have a really strong startle reflex. So any sort of loud noise, or they'll even do it to themselves where they'll accidentally roll over without realizing, and they'll startle themselves, and then they'll wake themselves up and start crying. So those sleep sacks or those swaddles really do help minimize that startle a little bit and maybe sleep a little bit better.
Yeah.
So you mentioned that babies need to be fed every 3 hours or about every 3 hours. So what is normal with that feeding schedule besides just the 3 hours? Like, how long are they feeding for? Do they have to finish a whole bottle, or how long are they doing that for?
Yeah, that's a great question. This is where most of the new parents' brain power is spent. It's with feeding and how do we feed and all of that. So in addition to feeding every 3 hours, whether you are breastfeeding or formula feeding, it's totally a personal decision. Nobody is going or should fault you for choosing one over the other. There's a lot of benefits to breast milk over formula, but sometimes it's more appropriate to formula feed, especially if the parent's mental health is really struggling. Formula has a lot of great attributes. They've come a long way in developing formulas that have the appropriate amount of calories and carbohydrates, proteins, fats, and preparations that are easy for babies to digest. So I wouldn't hesitate if you made the decision to formula feed.
Can you do both? breast and bottle feed.
Absolutely. And that's oftentimes a really good solution for a lot of parents who really want to breastfeed and have that experience, but also let mom get a break every once in a while. So that can be a really good like 1-2 punch for that. But as far as like the duration of feedings, there's a wide range of normal. And for the first week or so, typically parents will spend anywhere from 15 to 30 minutes with feeding, where you'll do 15 minutes on one breast and 15 minutes on the other breast. Bottle feedings tend to happen a little bit faster just because the milk is readily available. Typically when feedings start lasting longer than 45 minutes, we start to ask, why is that happening? That can maybe lead the baby to work harder and maybe expend too many calories in a time when they're trying to grow a lot. Yeah. Feedings will typically last, about 30 minutes or less. And I like to use the acronym EASY, EASY, to help establish a baby's routine. Yeah. So it stands for eat or feeding. A is for activity or doing a little tummy time on the parents, like the parent holding the baby like this on their chest, or even on the floor is fine too. S stands for sleeping. That will take anywhere from 1.5 hours to 3 hours, depending on the baby. And then the Y stands for U or U time. So that's when, while the baby's sleeping, the parents should be planning or scheduling self-care. And that can take a variety of forms, from sleep or going shopping or spending time with friends that you haven't been able to.
Or showering.
Yes.
Basic necessities,
All those things.
Yeah. So are you waking baby up from sleep to feed, or will they wake up on their own?
So every baby is different.
Okay.
Yeah. I would say the majority of babies will wake up on their own, typically every 2 to 3 hours those first couple days. But sometimes babies really, really like to sleep, and it's hard to wake them up. And if we don't wake them up, they eventually become calorie deficient and they have a harder time growing. And so we do recommend waking your baby to feed every 3 hours, especially that first week or two.
If they wake up on their own, like say 1.5 hours into sleeping, should you just automatically go into a feeding, or should you try and stick to that 3 hour?
So every baby's a little different, and parents get to know their babies better than anybody. And so they will get to know kind of their cues and whether a baby truly is hungry, or if they just want to be held or soothed in some way. Okay. Because you do want to make sure you're not feeding your baby too much. Every time your baby cries, you give them some milk. You can feed them too much, and that can lead to other problems. So I would say typically if your baby's slept at least 2 hours and they're acting hungry, it's a safe bet that maybe they would do fine with a little bit of milk.
I've heard multiple pieces of advice as far as feeding goes, where some say, if they've had this much milk, they are done. But I've also heard people say, like, you should never stop your baby from feeding if they're like still hungry. What are your thoughts on that?
So yeah, and you have to define, like, what does it look like when your baby is still hungry or when they're full, right? So generally speaking, when a baby is done feeding, their suck starts to become a little weaker and slower. They'll tend to delatch from the nipple more often. And when you touch the side of their mouth, they tend to not search for the nipple as much. Okay. That's how you know that they're maybe done at that point. But especially for those first few days, I think that's good advice. But I would say once you start to approach like that 45 minutes or like an hour and your baby still is like sucking strong, I would stop at that point. It's just better for the baby. It's better for mom if she's breastfeeding to try to stick to that every 2 to 3 hours. Let's hold off until it's been that time.
So with different spit up and spittle and all those things, what is considered like a normal amount or a consistency? Like, I know a lot of parents have questions about spit up and then colic, reflux, all that. Right. So we were wondering if you could answer a couple of those.
Yeah. And so you'll be working closely with your pediatrician to help answer this question. This is one that's really hard to answer just over the phone, because you do have to take into account multiple pieces of information. So first we'll talk about, okay, how much volume is your baby taking and over what period of time? And then we want to look at, is your baby growing? Are they meeting their normal growth milestones? We also want to take a look at your baby's wet and dirty diapers, making sure that they're having enough. The more that they intake, the more that they'll output, in a way. Also, we also measure jaundice and their blood levels. All of these things help us know whether or not spit up is a problem. If all of these things look good and your baby is on track with all of their milestones, if your baby's spitting up, it's normal, most likely, okay? Especially if they're not in any significant distress during it, okay? Most babies that spit up are what we call happy spitters. And
I've never heard that term
We just let it happen. We literally just let it happen, and it eventually gets better and goes away, typically between like 6 and 9 months. It usually tends to go away. And so for those babies and the parents that deal with that, it is frustrating to have to clean up a lot. But medically speaking, it's normal, it's okay, and it will go away on its own. Colic is defined as like excessive crying. And so what we're talking about, it's not like 30 minutes or 60 minutes of crying. This is like 3 hours a day or more of crying. You'll be working with your pediatrician about this and like asking, hey, is there something wrong? And if it's determined that medically your baby's okay, like there's no meningitis, there's no fever or sepsis, and like everything else is doing okay, your baby's growing well, then we start to talk about colic. And there are some strategies to help with this. We talk about burping frequently, trying to get out as many gas bubbles as possible. We make sure that your baby is having like normal amounts of dirty diapers. If they're constipated, sometimes that can lead to a little bit of extra fussiness. We also talk about doing like bicycle kicks with your baby to help move gas along.
I've seen that on TikTok.
Yeah. They do like and then they put it down and then they put it back up and then the baby toots. It's really cute.
You'll be surprised. Like there's often times where the baby will like pass gas. And then they'll like magically be a little bit better after that. Something else that I think is really helpful, especially when you're just at your wit's end and you don't know what else to do. Your baby's crying and you're just tired.
Yeah.
Okay? Put them in their car seat and go for a car ride. That's like a secret sauce for a lot of babies.
I was going to say, I feel like a lot of...
Even if it's like 2 a.m., like if I was the parent and I just am so tired, I can't be in bed, I might as well be out like doing something and driving. And now my baby is like, it distracts them enough that it helps a lot to help them to stop crying. And then, you might have an easier time transitioning them back to bed after you get back from that car ride.
I've heard another secret trick. I'm not a parent, but I've seen like family members do this for their babies. They'll put them feet first and then lay their head down, because if they would put their head down, the baby would wake back up. So they would put their feet in the crib first and then lay them down. I was like, that's genius. But like you said, every parent gets to know their child very well.
Yeah.
And so, I mean, some things work for some babies and other things don't.
Yeah. So obviously babies have sensitive skin. And I know babies can get rashes, dry skin. A lot of babies get cradle cap. Can you kind of walk us through what's a normal thing for a baby to have, and what are things that people should look out for that are maybe not so normal that they should address?
Yeah, this is another common question that we get. So think about it this way. Your baby was just in like a wet, warm environment for many, many months.
Yeah.
Right? And now they were just born and they're exposed to this dry Utah climate. Most babies have really dry, cracked skin for the first month or so. It's normal. There's no amount of lotion or skin product that is going to like
baths.
It's going to take care of it or like magically cure that.
Yeah.
It just gets better on its own. So we typically recommend no lotion for the first month of life.
Okay.
But you might notice that your baby will develop a diaper rash. Baby's skin is very thin and it is more prone to things like diaper rashes.
Yeah.
So it's a very good idea to have an ointment, either like Aquaphor or Vaseline, that you put in the diaper area kind of as a preventative against diaper rash.
Yeah.
And then if your baby does develop a diaper rash, to have a diaper rash cream. These typically have zinc oxide in them, which acts as a really good barrier between the skin and the diaper contents. So diaper rash is another really common thing that we'll see. Baby acne is a thing that comes up quite a bit.
Yeah.
This is another normal skin appearance. So it'll look like your typical acne that you're used to seeing on teenagers, but it's on a baby. Don't worry too much about this. Bring it up with your pediatrician and make sure that there's nothing else going on. But most of the time, this is a very normal thing, and it just goes away on its own.
So what are some recommended skincare products for babies that are safe and gentle on their skin that they can use?
Yeah, so I would say any go-to products would be an ointment like Vaseline or Aquaphor. That's going to be really big. A diaper rash cream would be really important. And then I would say a very mild soap for bathing. It typically doesn't have any fragrance or dyes or anything, just a very mild soap.
Yeah.
So a cradle cap is, a hat that comes with your cradle, right? No, what is cradle cap? I've heard it has something to do with like their scalp, and is it because they're laying on their cradle for too long, or what can you do to kind of prevent it or fix it if it happens? Yeah,
so it's a very common thing. A large portion of babies get this, but a very easy preventative is, so typically it happens on the scalp, around the hair, typically because there's more oil that's produced by the hair glands up there. This provides like kind of an environment for fungus to grow, and that's what leads to cradle cap. So typically when you bathe, we recommend most babies bathe 2 to 3 times a week. You get your gentle soap, and then a really fine tooth comb can be really good, or a soft bristled toothbrush works really well. If you massage some of the soap into their scalp and then use one of these things to kind of gently scrub some of the areas where you see the cradle cap, you can kind of break apart some of the plaques that are there. And if you do that on a regular basis, you typically don't need any like additional medications or prescriptions to help with that.
Parents worry about milestones a lot in their child if they're not measuring up to maybe their friend that had a baby around the same time, or that they're concerned their child's overweight, underweight. What are some of these misconceptions about milestones? What's normal with them? What's not normal with them? And why is coming to see a pediatrician regularly so important for those milestones?
I think this is one of the miraculous things about human development, is that it's so individual. And there's so much comparison that happens, between families, parents comparing children from different families. And that can be really hard and rob people of a lot of peace and just joy.
Yeah.
So I highly recommend, not comparing your child to anyone else. It's very, very much individual. But when we're talking about a newborn and a new parent and like what to expect, there are some reflexes and some milestones that the babies come pre-programmed with. And we've talked about a little bit of them so far. Have a lot to do with feeding. So like the sucking reflex, is it strong or is it weak? So that's something your pediatrician will take a look at. Does your baby have a like normal nervous system? And he'll check for what's called the startle reflex. And he or she might like move your baby up and down kind of abruptly, and your baby's arms will kind of flare out and then kind of like contract, inward like this. That's a normal reflex. And things like that help us know that your baby's neurological system is functioning appropriately. You will be working closely with your pediatrician to know what milestones to look forward to, but I'd highly recommend looking up the CDC milestones. This is both a web page. You can just do an internet search of CDC milestones, or they have an app that works really, really well. And you can actually input your child's like name and date of birth, and it will help you track what milestones to look forward to.
Oh,
that's
awesome.
A great tool.
Yeah.
I also like that app because it focuses on the newest data from the American Academy of Pediatrics that helps us know what milestones we really should be focusing on.
Yeah. I've noticed, so I have a niece and a nephew, and then have worked around children a lot in previous years. And one thing I've noticed, and I don't know if it's just me, but I feel like, so my niece and nephew both were like later walkers. Like they didn't walk super early, but they were pretty vocal at a young age. And then I used to be a receptionist at at our pediatric office, and I would see kids that were like 8 months old, like running around. I was like, how are you 8 months old doing this? But they, I mean, obviously weren't talking or anything like that. So in my mind, it was like, oh, if they're walking sooner, they're talking later, or if they're talking sooner, they're walking later. Is there a correlation, or is that just something that I saw?
Well, it's definitely one part of the brain is developing a little bit faster than another part of the brain. And it's so individual, right? Yeah. Some people we say are left-sided brains, and other people are right-sided brains. Yeah. This is true with childhood development. So it's nothing that parents should worry about or be concerned about, because in the end, it's like every child is awesome and unique. They have their own strengths, and their like personality and their lifestyle is highly dependent on how they developed as infants and toddlers. And so, I think you're very like astute in observing that, but it's nothing that parents should worry about.
Another concern that parents might have, or question really, is how often they're supposed to be taking their new child, their baby, to the pediatrician for well child checks. Mm-hmm. And then also, what if sick visits are thrown in there? Like, how often are you supposed to be taking your child to the doctor?
Yeah, so that's a really good question. And it has a lot to do with what we just talked about, with keeping track of a child's milestones and growth parameters. Mm-hmm. So we want to make sure that they're reaching their milestones, that they're growing appropriately. We also want to be available for any concerns that parents have. They will be entering their first respiratory season during that first year, so it's likely that they're going to get sick multiple times. We also just want to be available for any behavioral concerns, right? Is my baby crying too much? Or, when do I start sleep training? And, things like that. Those are things that your pediatrician will be readily available to help you work through during that first year. Yeah. But the typical schedule is that you'll meet with your pediatrician within the first few days of being home from the hospital. And then maybe like a couple weeks later, just to make sure that growth is happening at an appropriate level. Then we can space it out every 2 months, where we continue to monitor growth and development, but we also plan for vaccines at those visits, at the 2-month, 4-month, and 6-month visit. Then baby comes back every 3 months from there. So we continue to space it out. At the 9-month visit, we kind of go into a lot of depth of your baby's development during that particular visit. And then babies comes back at 12 months, 15 months, 18 months. And then after that, it's just once a year, unless there's other concerns.
What can parents expect as far as the vaccine schedule, and what are some potential side effects that they should expect to see?
Yeah, that's a great question. We get these questions a lot. So vaccines, no matter what your experience was over the last 5 years with COVID, there is no question that there is substantial evidence that they are safe and effective at reducing serious illness and injury later on in life. Mm-hmm. So what parents can expect is, maybe depending on the time of year, 1 or 2 vaccines in the first week or 2 of life. Also depending on if mom received the RSV vaccine during pregnancy. Yeah. So if mom didn't receive that, then expect to have the baby immunized or need that immunization either before the RSV season, or mm-hmm. if you're already in the middle of the RSV season, within the first week or 2 of life. So then we get to the 2-month, 4-month, and 6-month visit, where we're able to safely combine vaccines together, typically into 2 pokes and 1 oral vaccine, where we can protect against 8 different germs, mm-hmm. which is remarkable. It's awesome. Germs that are known to cause really serious problems in kids. And then if they're up to date with that, typically don't need any more vaccines until they're 1 year old. So expect vaccines at that point, maybe, once a visit, 1 to 2 pokes, just to kind of get them fully boosted to be fully protected against each of those germs.
Yeah. In my experience, some parents don't like to get all of them at once. They like to space them out. What is your opinion on that?
So usually parents are just concerned about like causing extra pain, right? And most of the time, once you've done that route a couple times, you start to realize I'm just prolonging this a lot longer than needs to happen.
Yeah.
And it becomes like every time baby comes into the office, they need to get another poke in order to get fully, protected against all these different germs.
Yes.
And so it prolongs the time it takes to become up to date with your immunizations. You also begin to realize if you do give vaccines, maybe with 2 or 3 at a time, there's no difference from the baby's perspective. They tend to go back to their normal selves within 24 hours, regardless of whether it's 1 poke or 3 pokes.
Yeah.
And so for that reason, I highly recommend just getting it all done. It really helps them to not feel like they're getting poked every time they come in to see their pediatrician.
Yeah.
As far as side effects go, there's no difference whether a baby receives 1 poke versus 2 or 3 pokes. Most babies will have a little fever, and that's okay. That's something we expect. And that tells us that their immune system is actually working. It's doing its job in developing immunity against that specific germ.
Yeah.
So fevers are not a problem. Babies will, also tend to be a little bit fussy for a day or 2, or they might sleep more than they usually do for those day or 2 after they get the vaccines. But like I said, usually by day 2 or 3, they're back to their normal selves.
And I know we did touch on some respiratory issues that can happen, especially within those first few months of life. As a new parent, what are some concerning symptoms that a baby could potentially have that would prompt you to take further action and maybe take them into a doctor to see?
So it's a really good question. If we're talking about a newborn, sometimes one of the only symptoms they'll have is a fever. Okay. So if a baby has a fever, and a fever is defined as 100.4 degrees. So if it's like a 99.8 degree temperature, not technically a fever. But if it gets to be higher than that, I would start talking with your pediatrician what to look out for.
Yeah.
Okay? Other common signs for respiratory illnesses will be the baby is breathing differently. Commonly, this will be grunting, where with each breath, you'll hear a little grunt noise. Okay. They'll also be breathing faster. So normally babies will breathe between 30 and 40 breaths per minute at most. But sometimes when they're sick, it can be 50 or 60 or more breaths per minute. Okay. You'll start to notice their ribs are poking in and out and working a lot harder to assist their breathing. Okay. So those are some things that you can watch out for. Most of the time, it's pretty apparent to the parents that they need to get their baby checked out.
Dr. Naegle, I just want to thank you for coming on here and sharing this with us.
Sure, you
This
bet.
is such helpful information, especially for new parents that are coming into this with no prior knowledge, no kids, nothing to look at to know what's normal and what's not. I want to put it out there for those who are listening and watching that may be a new parent or are getting ready to be a first-time parent. Dr. Naegle will be starting a new parenting class. The details are not set at this time, but we will have details on our social media and in the caption below. And if you are interested, he will be doing those about once a month. So if you're interested in that, go ahead and click on that link and you can sign up for one of his classes. He is also accepting new patients at this time. So we highly recommend that if you are searching for a pediatrician, that you make an appointment with him. Obviously, from this episode, you can tell that he has such great knowledge and helpful tips for you and your children and your growing family.
Don't forget to follow us on our social media to keep up to date with any new podcast episodes that we have coming out, and to look out for more insights and tips from many of our providers here at Tanner Clinic.
Thank you for joining us on another episode of Is This Normal, Doc? And we will see you next time.